Hello everyone, my name is Steven. I'm from Indonesia. Today I want to talk about something that is quite specific. It's a solution for the toughest acne scar. One of the toughest acne scar to me is the nasal ice pick scar. So I have no disclosure. Okay, so we all know all these types of acne scars: the macular type, PIE, PIH, the atrophic type, ice pick, rolling scar, box scar, and also the hypertrophic or keloid scars. And they're usually due to neglect or late acne treatment. But they can also present pretty early on before the acne, nodules, or papules rupture. And we can all agree that they're all extraordinarily difficult to treat. So what is really the toughest to treat? So for me, it is the ice pick scars that is on the nose. It happens to many patients, although acne on the nose is relatively less common to compare to other areas of the face. And this is mainly due to improper facials that is done by non-medical professionals to remove what they seem to be called comedones. So the current recommendations for ice pick scars are TCA cross and surgical excisions. But TCA cross on the nose is quite dangerous because, with the curvature of the nose, you can risk a spillage and thus widening the scar. You can turn the ice pick scar into box scars. There is also the option of surgical excision, but because it's on the nose, there is a limited amount of removable tissue, and there is also a risk of distorting the anatomy as well. So what about ablative lasers? So ablative lasers, but still the gold standard until now. They give great results, but they have a pretty long recovery time with a really high risk of post-inflammatory hyperpigmentation, scarring, and infection. So then I also thought about pico-laser refractional optics, right? This is one of the most modern, the most up-to-date technology. And I use the fractional optics because the thought is that if I turn the full beam into small individual stronger beams, I can create small explosions. And then these small explosions are also known as LIOBs, or laser-induced optical breakdown. And thus, it will increase the production of collagen, elastin, and mucin, and will repair acne scar. But unfortunately, I've tried this to a number of patients, and unfortunately haven't been getting good results with the nasal ice pick scar. So the question is this: how do we maintain efficacy while lowering the downtime and risk? So we are introducing this method. We call it the FASTA method. It's called a focused CO2 for acne scar treatment and recovery, and we hope to lower the downtime and lower the risk of complications. So the idea is to target individual scars while leaving the rest of the skin on the nose. This will result in lower downtime, and there is no risk of spillage or widened scar as in TCA, and we can treat as many scars as we can because no tissue is removed, unlike surgery. So the way we do it is that we did a case series involving 10 Asian participants, respecting skin type 3 and 4, with ice pick scars on the nose. None of these patients have had prior medical treatment. The fractional CO2 laser that we used was a Fraxis by Cutera. We used the fluence between 12.6 millijoules to 35 mJ with variable spot sizes. And the idea is to have the spot sizes only very slightly bigger than the actual scar. The density can go all the way down to 3, all the way up to 10%, but I personally like to hover around the 3 to 5% mark. And we did 5 treatments with a 4-weekly interval. So for post-care instructions, I like to use the gel-based moisturizer, so I don't use steroids. I always recommend the patient to use a sunscreen of minimum SPF 30. So how's the downtime? So downtime can last between 7 to 14 days. We always instruct a patient to always use sunscreen. Never pick on the scabs because the scabs can be very, very tempting for the patient to pick. We always ask the patient to avoid using salicylic acid, glycolic acid, or retinoic acid creams until it completely heals. So then we can get pretty good results. So here's one patient that has the ice pick scars on the very difficult area that is on the nail crest. With this method, we can actually get pretty good results with minimal downtime. Another one of our case on the tip, an area that would normally be very difficult for TCA cross or for surgical excision, we can also get pretty good results, and the patient is very happy. So in conclusion, acne scar on the nose, it happens exceedingly common, and they typically present as ice pick scars and often wrongly diagnosed as large pores. The current treatment recommendations, such as TCA surgery, are often not suitable due to the risk of spillage and anatomical limitations. And the ablative laser can be used. You can get great results, but also with pretty high risk of complications. The fractional picosecond laser is unfortunately not very effective, despite being a new technology, relatively. So the faster method can be a solution to target individual ASV scars on the nose. I thank you.